Hello everyone, Dr. Kevin Logan here, and I want to introduce Jody Rasp. She's our medical esthetician. Welcome, Jody.
Thank you. Thank you.
And I just wanted to share a little bit about her experience. Jody's been in medical aesthetics for over 20 years. She's a licensed medical esthetician. She's the latest addition to the Logan Institute. And we're happy to have her because there's a lot of people that are seeking services outside that may be exposed to things that could be harmful or potentially risky. And I want people to actually be able to get services that are safe and natural and will help work with their own skin type and the health of their body. So I just want to give a little bit of background of how I became interested in medical aesthetics. Approximately 8 years ago, my oldest son was struggling with cystic acne. He had a lot of severe scarring and enlarged pores and was really struggling with self-esteem issues. In searching for solutions for my son, I came across a group of medical estheticians that were training on natural ways to help people take care of their acne and also help them recover from the scarring that they had experienced. So I went to a medical aesthetics course and I learned about regenerative aesthetics, and that was my first introduction to medical aesthetics. On a personal note, I want people to understand that we all experience some ultraviolet damage to our skin, and that has risks of developing precancerous and cancerous lesions, as well as pigmentation and other damage to the skin. It's important that we protect our skin, and one of the best ways to do that is actually using microneedling in combination with the regenerative therapies, because that will actually enhance the antioxidant potential of the skin cells. And the reason that people have sun damage is because their antioxidant levels are too low for the ultraviolet exposure on the skin. That's when the harm occurs from ultraviolet light. I'm not a big fan of chemical sunscreens because those have inherent risk as well. And so our bodies naturally produce pigment over time that will actually protect us. Over a lifetime, the antioxidant potential decreases, and therefore the regenerative procedures can actually help reverse some of that. So I'm going to introduce Jody and let her talk a little bit about her background and all the things that she's been doing over the last 20 years. Welcome, Jody.
Yes. Thank you, Dr. Logan. I'm so glad to be here. I'm Jody Rasp. I'm a licensed medical esthetician. I've been practicing over 20 years. I too became interested in all things aesthetics because I also grew up with severe acne and was very self-conscious for years. Also very sensitive skin, so anything we would try to do to treat the acne, that would open a whole nother can of worms because my skin was so sensitive to these harsh ingredients. So just throughout the years, just always struggled with bad skin. And I never felt like anybody really saw me. I felt like they were looking at my skin. So in the beginning of my career, I worked in the plastic surgery industry. I also worked and had a great experience in dermatology. I really focused on laser procedures, chemical peels. I also got a great experience in microneedling. We like that a lot here.
Jody, can you tell us a little bit how you became interested in the area of natural aesthetics?
I think by experience and by learning, working on myself. I look back at some of the procedures and things I did, and I think sometimes that some of the fillers and the harsh lasers, those can create problems on their own.
Sure.
Right? We're going to treat one thing, and then the next thing you know, now I've got post-inflammatory hyperpigmentation from the laser and some of these harsh chemical peels, or maybe doing a little filler and a little Botox, and the next thing you know, my face is frozen, my lips are huge, and I think that just long term is not good for your health. Just kind of like we talked about the sun and increased sun exposure and the damage. We don't necessarily see that right away, right?
Sure.
It's long term, a cumulative buildup. Sometimes I tell my patients, a lot of your damage is done by the time you're 18 years old. It just doesn't show yet. Right?
True.
And so I think what I love about being here and working with you is we've created safe, healthy alternatives to have the best skin we possibly can, because as you know, it's our largest organ, right?
Sure.
I think it's the window of what's going on inside. I don't know about you, but I can see things that could be alerts on their health by just their skin and what I can notice and pick up on.
So we're very excited to have you here, Jody. We're excited for our patients to learn more about your services and all the things you're going to be offering here at the Logan Institute. Would you please let us know what are some of the services that you're planning to offer and what the benefits are and how those work?
Sure. We offer anything from microneedling, PRF microneedling, custom facials. I have a great technique I love called dermaplane. That's an exfoliation technique. We also will offer IPL. It's a impulse light therapy treatment. That's great for pigmentation, sun damage, rosacea, laser hair removal. We can offer that as well. All kinds of fun stuff. And I think we're always learning and growing, and we'll be adding more things on as we go.
Very good. So in your experience, do you think some of those chemical peels and the some of the 5FU, which is used for a complete peel, and somebody who has precancerous lesions, are there risks to those things?
I do think that there's risk to those things. I think, anything we put on topically, as you know, within about 30 seconds or so, that's going to probably touch every organ in your body. So I think we need to be conscious of what we put on our skin. So I think what we offer, a great thing we offer is alternatives. Microneedling, that creates a micro injury. So our body's natural response is to heal. And with that healing, that stimulates our collagen, elastin, our own human fibroblasts.
So in addition to the microneedling, we offer an added service with the regenerative piece, which is PRF, which is platelet-rich fibrin. And that helps enhance the body's own healing mechanism, helps increase collagen production, and helps with elasticity. And with that treatment, we're also able to create a custom night facial cream, which actually is made up of concentrated growth factors. So those are derived from the platelets of the patient's own serum. Often in Europe, you can find products that actually have the growth factors, but those are peptides that are coming from outside sources, and these are actually coming from one's own body. So we can put that into a night cream. People apply every night after they do their facial cleansing and toning that night, and then they add the night cream, and that actually is an enhancement to help with the anti-aging aspect of the skin, and is very effective, as I mentioned earlier, for helping to improve antioxidant potential as well. So what other things do you think work synergistically with some of those treatments, Jody?
Well, another thing we have is we have a IPL machine, and what's great for that is treating with a light source, light energy. It's called impulse light therapy, also known as photofacial. What that is great to do is treat the pigmentation. So we're going to bring that pigment, those sun damage, bring that up to the surface, up and off the skin. And so that's great because we're not adding any chemicals or anything like that. We're using a light, that energy of a light. That is great for treating rosacea, post-inflammatory hyperpigmentation from acne scarring, again, the sun damage, and also, we can do the laser hair removal with that machine, so that's pretty exciting. Another exciting thing we offer is, again, the customized facials, anywhere from anti-aging to acneic. Also, we do dermaplaning, I do waxing, brow tinting, all kinds of fun stuff.
That wraps up all the therapies that we wanted to discuss today. I wanted to share with everyone my experience with the microneedling. So I've seen the dermatologist and have been advised, because of some ultraviolet damage to my skin, that I should undergo a harsh chemical peel, and I was not willing to do that, because I've seen some of my patients that have been through that have had severe skin infections and also severe redness and other problems after the procedure. What I've experienced with the microneedling, utilizing the regenerative platelet-rich fibrin, is that my skin is actually more resistant to the effects of sun. And so I can be out in the sun longer, and I don't burn as easily. So I know that inherently I've actually produced more antioxidants in my skin, and I'm having fewer of those precancerous lesions getting frozen off by the dermatologist every year. So I've seen a change in my own skin, and I'm happy And my mother did give me good skin, but I also am a big gardener, spent a lot of time in the sun, and I did not wear sunscreen like my dad recommended. So I unfortunately have had some sun damage, and now I've had to kind of do some repair work. And now that Jody's here, I have somebody to help me do that, so I don't have to do it to myself. If you're interested in scheduling an appointment, please call the office or check our website. And I want to thank Jody for coming today.
Thank you.
And it's been great having you, and great to have you here in our office.
Thank you so much. And feel free to call, and we'd love to schedule you a complimentary consult.
And next week, I'm going to have Jody do a demonstration on myself. So she's going to do the microneedling to me, and I will actually show everyone that it's relatively painless. I'm going to do it without anesthetic, so that you can see what that's like, although we do offer a topical anesthetic to reduce the discomfort when you're undergoing the microneedling. But I just want everybody to know that is an option, and next week we'll be demonstrating that here in the office with Jody.